Good afternoon, it's Mark Larson giving you our COVID-19 update. So no new cases today in Kittitas County, so that's a great thing. We are currently meeting all of our metrics to progress into phase 3. And those metrics include number of cases per 100,000, percentage of tests that are done per positive case, hospitalizations for COVID-19, other things about hospital readiness. So we're good in regards to that. So on Wednesday of this week, I will finish my part, Tristan will finish her part. We will take that to the Board of Health meeting on Thursday. The Board of Health and the Board of County Commissioners have to vote on that process. Then it goes to Secretary of State Wiesman that afternoon. And since we're meeting all the criteria, I can't imagine that they would say no. So we should know, throw myself out there sometime early next week. So that's a really good thing, and that's where we're at currently. All of our patients are currently doing well. We have 2 patients that are actively being followed, and we are following some folks that live in Yakima but work up here to help out the folks in Yakima and to make sure that our employees that work at businesses here are being taken care of. So we're doing our work. So let's go to questions.
Because we've had no hospitalizations of the Twin City Foods positive cases, some people conclude that COVID-19 has been overhyped. Would more detailed data refute this? Regardless, can more detailed data about the severity and length and current status of these positive cases be made available to the county?
Yeah, so it's easy to see if we look at a lens that just focuses on our county to say it's been overhyped. We've had 0 deaths. We've had 92 cases, but I was just on a phone call this afternoon with our Region 7 partners, Grant County, Chelan Douglas, Okanagan, and their numbers are going crazy, especially Grant County. So their numbers are going way up. If you look in Yakima, they've had multiple deaths. They have 50 people currently hospitalized today for COVID-19, and they've had multiple deaths. We've had 2 patients that were transferred up here from Yakima because they had no room at the inn. So we've been fortunate here, but it's not that the disease has not been strong. I can tell you that the people that we which had COVID-19 here were both older. One was 64, the other one was 77. One spent almost 10 days in the hospital and got IV remdesivir, which is one of our newer agents for treating severe COVID-19, and the other person spent 5 days in the hospital in the intensive care unit here. Both patients went home on oxygen. So it's a significant disease. I can't really share much about the individual patients here, other than to say the age of our patients have been very young, and a big part of that is because we've kept it out of the nursing home, and people have been doing what they should be doing and staying home. So our population, we're really primarily Hispanic employees and their families who work at Twin City Foods. So, and we expect to see more of that group coming. So more cases, more hospitalizations, but less deaths in that group than in other groups. So.
Of the total positively tested in Kittitas County, how many were asymptomatic?
So it's above 70%. Almost all of our patients at Twin City Foods were symptomatic. We've had a few people that have gone through the COVID clinic that were at one of our protesters was asymptomatic. We wonder whether they're actually pre-symptomatic, because maybe if we gave them a couple more days, they would have been symptomatic. In that same Region 7 group that includes basically us heading northward in central Washington, 72% were symptomatic.
If Yakima County stays in phase 1 and we move into phase 3, will there be any travel restrictions from or to Yakima?
None other than the ones that I've been telling you all along. Don't go to Costco, don't go to Yakima to shop. Do not go down to do sports in Sela, even though the baseball field's open, against the governor's order. And vice versa, I've been asking folks up here not to schedule their baseball fields, for example, for folks outside the county, because why would we want to bring in a whole bunch of people from outside the county to potentially spread disease here. So some of those decisions are not ones that I can control. I can just ask people to shop locally, and I think people have been doing a really good job at that.
If my boyfriend lives in Yakima with his 80-year-old grandpa, how long would I need to be symptom-free by isolating myself from other people before I could visit them safely?
Well, your boyfriend's grandmother is in the high risk category, so you'd have to be really making a choice of, is it really important that you go visit them there and put them at risk? If you isolated for 14 days and were not ever around anyone else, it would lower your risk, but not to zero. So my recommendation would be wait. But the longer you isolate yourself, the less disease. And I would probably stay away from her. Although if you give it to your boyfriend, then she could give it, or he could give it to her, and that would be a problem. So we're asking people not to travel to see people who are at risk. That includes people in the nursing homes.
My sports buddy believes that COVID-19 virus is no more deadly than the seasonal flu, which kills around 75,000 Americans each year. How can I reason with him?
Yeah, so if you look at the data, it is more deadly than the seasonal flu, and we're still going to have the seasonal flu this year. So we've already had over 115,000 deaths in the United States this year of COVID-19, and we're going to have another 75,000 deaths due to influenza. No one has any immunity to COVID-19. The disease too is much more severe for the general population than influenza is. So it's difficult to argue with people that want to take a different approach, but the data is out there. They could look at the health information metrics out of the University of Washington. That probably gives you the most accurate information, and the Washington Department of Health.
Will the 6-foot social distancing requirement most likely be in place until a vaccine is widely available?
So if you look at the governor's website in regards to the phased approach to reopening Washington, it has social distancing listed as into phase 4. Also, if you look into the document itself, it talks about social distancing. So I had this discussion with the school superintendents and athletic directors this afternoon. Phase 4, there's still social distancing. Phase 4, even if we have something like a football game at Central, there's still going to have to be social distancing. So it's going to decrease the number of people that could fit into a facility. That said, less risky to have things outside.
The last question, what are your thoughts on the rodeo board still wanting to have the rodeo this year? It is just inviting people from outside our county. It feels like they're putting profit over the safety and health of our community.
So each organization has the ability to make decisions based upon what's important to them. I think there's some history involved in the Ellensburg Rodeo. They have made a decision not to have the rodeo parade this year. They are asking the governor for a variance because we'll probably be in phase 3 still. But even if we were in phase 4, they feel like they have to have a certain number of seats filled to make it financially viable for them. But it's really done based upon historical and to benefit to the community. So there is a higher risk of having those things happen. It's a higher risk of going out and protesting for social justice. It's a higher risk to go out and have a political rally. those things are allowed under the First Amendment, but they are risky, and we all are making a choice. So if the governor does allow them to have the rodeo, which you can follow what's happening with professional sports to see whether that would happen or not happen, then they would still have to be maintaining social distancing, and you just have to make a decision as an individual whether or not you're choosing to go. So I would like to talk about going forward. So talking about metrics, we're meeting all the metrics, except for the one that is important to me, which is all of us buying into this process. So we need as a community to support each other. We need as a community to do this. We need as a community to wear masks because it's the only thing that we have currently until we have a vaccine. And the community's done really well. That's why we have we have 0 deaths and we have 92 cases. But we could do better. We should not be having neighborhood get-togethers. We should be still staying inside. We should encourage the elderly to shop at Safeway or Super One early in the mornings when there are not a whole lot of other people around. We still need to be watching out for our neighbors and watching out for people at risk. Because what we're trying to do here is move forward as a community. And what I would ask for you is to look at what's happening to all of the communities outside of us. And we are sitting in the middle of communities that are having big problems. We are trying to move forward with opening schools, with opening the college, with allowing things to get somewhat back to normal until we get a vaccine. So my ask for you, so we can get to the metric that's important to me, which is community engagement, to still do your part to make this work, because we can only do a small amount of it here at the health department, and the rest of it depends upon you. So I hope you can buy into that, and we'll see you tomorrow. Thanks.